The Connecticut Alliance for Retired Americans recently embarked on a Healthcare Stories project. We collected 80 stories, mostly from retirees, and asked them how they felt about their health care. Most people are worried that their Medicare or Medicaid might be cut, and they're also concerned about the rising cost of prescription drugs. Here are some of those stories.
I live alone. My husband passed away 6 years ago, and I have to take care of things in the house and around the house myself. Secondly, the income that I receive is very low, so that I could never afford to get the infusion if I didn't have Medicare. Never would I be able to afford it.
Well, I'd probably either be broke or dead or both, you know. One of the things is, like, there's no way that anyone can survive today without some kind of health insurance, without going to the emergency room for treatment, because that's, what else would you do? I mean, there's not that much money to cover the kinds of health care, that's how expensive it is today. And so everyone should have the same health care I have. And I do believe that to the depth of my heart, that that's something that's a right of everybody.
And I'd probably have to go on state aid too, which I really don't want to do.
The most important about health care is that if we don't take care of ourselves, we can't take care of our family or our community. And so it makes sense in more ways than just the individual. It makes sense for the whole country, and it uplifts the whole country. And that's why I think it's another dimension of health care that people sometimes ignore that I think is very important.
And I don't want to be dependent on other people. I want to be self-sufficient and be able to take care of myself. I mean, I function in the community. I volunteer where I can at Soup Kitchen. But if I didn't have my health and was incapacitated, I wouldn't be able to do the things that I do. So it's so important that I have this insurance, and I appreciate it.
I could never afford to hire anyone to come in and do my housework or cook for me, or even give me a bath. And these things are indispensable. But with the medication and with the health care, I'm able to do all these things, plus help others that's in need.
In general, I'm saving the government money by staying healthy. But to stay healthy, I go to the dentist 4 times a year. I get physicals. I go to eye doctors and bone density tests and all these kind of things that, as we get older, prevents us from running into problems.
It's time that the upper class of wealth realize it's not always because we have not worked hard, or it's not always because we're lazy, or not because we're lazy. It's because we have not had the opportunity, as some have had, to become millionaires. And we are doing the best that we can and sharing within our families to try to help each other live. So it's important that the administration really take a look at what they're doing to citizens of the United States.
These analyses that they do that are preventive really can save your life in the long run. Well, everyone wants to be independent. As we age, we want to be independent. We don't want our kids taking care of us. We don't want our neighbors to have to take care of us. We don't want our spouses to have to take care of us. We really want to be independent. And in order to be independent, we have to be healthy. And in order to be healthy, we have to have health insurance.
I don't know how I'll get to pay those bills if I do run out, don't have any insurance. It will be very rough.
No one should have to go without health care. I have friends that have huge co-pays on their insurance, and they have to think twice every time they go to the doctor. I have people that don't go because they because they don't have health insurance. I had clients when I was working through the years that didn't want to go to the doctor because they couldn't afford it, or they couldn't afford the money to put gas in their car to get there. For all those reasons, health insurance is just so vital, and everyone deserves it.
I don't know how I'd make out. I wouldn't have as I say, I have a little bit saved, but it wouldn't last no length of time because medical is so expensive. As you know, everything is so expensive. And if I have to pay out of pocket, I don't know. I would maybe lose my house and everything. Then I'd have to go live with my son. And I don't want to do that.
The aid that was given to me, if it was just cut off like that, I won't be here.
I won't be able to get around like I do, and I'm a very active person, and I still enjoy life, and I want to continue to with other people, and I'd like everybody else to enjoy life too.
If it wasn't for this Affordable Care Act, which was, what do they call that? Obamacare. Well, I guess I would be just gone. That's all. That's all I can say on that. If they take away their health care, then they just do away with me.
All seniors should be taken care of. I think that there should be a new system set up so that it's not a question of if you have money and you can go to the best doctors or whatever, but it's a question of taking care of the people and having a happy family America. If that would happen, I would go door to door and send letters and get everybody to bombard the White House and to see that that's changed. I would be able to go to plays and do different things and be active in the community and be a part of things. And that's what I think life is all about.
In all these stories, there are two important themes. One is independence. People want to stay healthy so they can be independent as long as they can. And the other is that if they take care of their health care now, it will save them money in the long run.
Protect our care.